Hey guys, it's your favorite god, Asclepius here on Olympia Radio. Today we're going to be talking about a rather controversial issue right now, and that is the topic of gods changing roles in medicine. Just to give you guys a little background, about 40 years ago, gods were the only ones who could treat humans. If you guys have been up to date on my most recent blog posts, you'll see that I give you a bit of information on that topic. Now, the sum of this change really all went back to the Greek doctors. As you guys all know, they were kind of the mediums of treatment in some cases. As time went on and people became more interested in anatomy, biology, and science in general, Greek doctors started using scientific observation and logic to find the cause and cure of a disease. While this news was unfortunate for us gods, it was a very intriguing topic to physicians like Hippocrates. In accordance with Dr. Carr's article on Greek medicine, which although doesn't exist yet, Hippocrates' Hippocratic writings was the stem for applying a logical system to treating patients. Now, to give a summary of the Hippocratic writings, it was a collection of Greek medical practices that contains an abundance of information, primarily on medicine as a science, the philosophy of being a physician, and the methods and ideologies within medicine. Now, according to the work, medicine was factual and known. Learning about the human body came primarily through research of the body itself. The doctors created an objective observation of the patient to try and diagnose them. Some of these descriptions included urine color, stool, skin color, sleeping patterns, and temperature of the body, just to name a few. Now, these descriptions went along with the proposed idea that the body is made up of four humors: blood, black bile, yellow bile, and phlegm. According to the Greek doctors at the time, if the patient was pale, this meant that they didn't have enough blood, and so they ate something like liver. Now, if someone had too much blood, a practice known as bloodletting, a scene depicted on the top of my blog on the pot would be used. They'd basically cut them open to release the blood. Now, when a physician was seeing a patient, they would compare the current cases, similar cases in the past to treat the individual. In this way, we see almost a total departure from God's involvement in medicine. The doctor is taking full control of the situation by examining the patient to see what might be out of balance and how to fix that problem. We also see descriptions of how doctors practice medicine. The collection describes how curing diseases with just drugs is not what medicine is or is meant to be. Therefore, physicians often started out by employing therapeutic measures like telling the patient to adjust their diet and exercise. If that didn't work, then the physician would prescribe medication. A talk we'll go into later, and if that didn't work, they would eventually use surgery, but tried to avoid using surgery at all costs. While what I have just discussed is from the Hippocratic writings themselves and Dr. Carr's article, there was an article, actually a website, that went a little bit more in depth about Hippocrates' views and how medicine is currently in 490 BC. They gave the example of how physicians are using a much more objective view of the patient in order to treat them. They give the example of using visual diagrams, listening to breathing, and smell, just to name a few. In terms of how the doctors supposedly treated them, they first used diet therapy, and then went on to hygiene and lifestyle modifications. They employed medicines, and then physiotherapy, and then hygiene, purification of therapies, and then finally surgery. Now, keep in mind that the website stressed that the first three mentioned were done by the patient alone and had no real doctor intervention. This is really the first time in our history when we are seeing an amount of independency of mortals, not only from the gods, but also from mortal physicians themselves. Now that we understand why humans are moving away from the gods, let me ask you guys this question. Are they just in their actions? With the beginning of the first teachings in medicines and using observations rather than prayers and offerings, I see where the mortals are coming from. But that doesn't hide the fact that they're beginning to rely on the gods less and less. Maybe we will have to send something drastic like a plague so that the mortals have to rely on us. Well, that about sums up our time here on Olympia Radio. Please feel free to leave comments on your opinions on the matter. Should mortals be developing their own way of medicine? Thank you for listening and have a pleasant evening.